Metformin is one of the most commonly prescribed medications for managing type 2 diabetes. It's a go-to choice for millions of individuals aiming to keep their blood sugar levels stable. At the same time, the question of whether alcohol can fit into a diabetic's life often comes up. The combination of metformin and alcohol isn't just a casual topic. It's a conversation that could have significant implications for health and well-being. Before we continue, I'd like to tell you about Diasalon, a powerful blend of 13 natural ingredients, each carefully selected for their proven ability to support healthy blood sugar levels, enhance insulin sensitivity, and promote overall wellness. You can read more on diasalon.com. To begin with, metformin works by improving the body's response to insulin and reducing glucose production in the liver. For people managing diabetes, it helps control blood sugar and, for some, offers added benefits like modest weight loss or cardiovascular protection. It's a cornerstone of diabetes care, but like any medication, it comes with precautions. One of those precautions is its interaction with alcohol. When discussing alcohol, it's important to recognize that it affects the body differently, depending on the quantity consumed and the individual's health status. For diabetics, this impact becomes even more pronounced. Alcohol can initially cause blood sugar to spike, especially with sugary mixed drinks or cocktails. On the flip side, it has the potential to lead to a drop in blood sugar levels several hours later, particularly if consumed on an empty stomach or after strenuous activity. This dual effect can make it tricky for diabetics to predict how their body will respond, even if they're not taking medications. Adding metformin into the mix introduces another layer of complexity. One of the key risks associated with this combination is a condition called lactic acidosis. While rare, lactic acidosis can be serious. It occurs when lactic acid builds up in the bloodstream faster than the body can clear it. Metformin slightly increases the risk of lactic acidosis because it affects how the liver processes certain chemicals. Alcohol, particularly in excess, can add to this risk because it also influences liver function and can lead to dehydration, another contributing factor for lactic acidosis. Now, before this starts sounding alarmist, let's take a step back. Many people with diabetes enjoy alcohol responsibly while taking metformin without experiencing any adverse effects. The key lies in moderation and awareness. Moderation doesn't have a one-size-fits-all definition, but a general guideline is limiting intake to 1 drink per day for women and 2 for men. For those taking metformin, this isn't just about protecting the liver. It's about maintaining stable blood sugar levels and avoiding unnecessary complications. It's not just about the quantity, but also the timing and type of alcohol consumed. Beer and sweet wines can contain a significant amount of carbohydrates, which might cause blood sugar to rise before it potentially drops later. On the other hand, spirits like vodka, whiskey, or gin have little to no carbs, but can still contribute to the delayed drop in blood sugar when consumed without food. Pairing alcohol with a meal can help offset some of these effects and provide a safety net for maintaining stable glucose levels. One of the most overlooked aspects of alcohol and diabetes is its impact on decision-making. Alcohol can impair judgment, which may lead to poor dietary choices, missed medication, or forgetting to monitor blood sugar levels. For someone managing diabetes, these missteps can have immediate and long-term consequences. So, what's the practical takeaway? Awareness and preparation. For anyone considering a drink while on metformin, a few simple steps can go a long way. Monitor blood sugar levels more frequently when drinking alcohol. Eat a balanced meal before consuming alcohol to minimize the risk of hypoglycemia. Choose low sugar or carb-free options to avoid dramatic swings in glucose levels. Stay hydrated with water to counteract the dehydrating effects of alcohol. Most importantly, listen to your body. If you notice unusual symptoms, don't dismiss them. Let's talk about some real-life examples to bring this discussion to life. Imagine someone attends a holiday party, takes their regular dose of Metformin, and decides to indulge in a few glasses of sweet wine. The festive mood makes it easy to lose track of how much they've had. Hours later, they wake up feeling unusually weak and dizzy. This could be a sign of delayed hypoglycemia, a condition where blood sugar drops to dangerously low levels. If the person hadn't recognized the symptoms, they might not have sought help in time. Now, picture another scenario. A casual weekend dinner involves a couple of vodka sodas and a hearty meal. This person, too, takes Metformin and decides to check their blood sugar before bed. The reading is slightly lower than usual, but they feel fine and take note to adjust their snack choices next time. By staying aware and taking small, proactive steps, they avoid any major issues and can continue enjoying occasional drinks responsibly. Another aspect worth mentioning is individual variability. Some people may notice no significant effects when combining metformin and alcohol in moderation, while others may feel the impact more acutely. Factors such as age, weight, overall health, and even genetic predispositions can influence how the body processes both substances. What works for one person may not work for another. Now for the part that might surprise you the most. Recent studies have examined whether moderate alcohol consumption might have protective effects for some people with diabetes. Research has shown that light to moderate drinking, particularly of red wine, might improve insulin sensitivity and reduce the risk of cardiovascular disease. While this is not a green light to drink freely, it adds nuance to the conversation. It highlights that the relationship between alcohol, diabetes, and medications like metformin is not always black and white. The bottom line is balance. For those managing diabetes with metformin, the occasional drink doesn't have to be off limits. The key is to approach it with knowledge and mindfulness. By understanding the risks and making informed choices, it's possible to enjoy social occasions and the occasional glass of wine or beer without jeopardizing health. Remember, the aim here is not to scare, but to inform. When it comes to managing diabetes, every choice matters, and every bit of knowledge empowers. Whether it's about diet, exercise, medications, or lifestyle habits like drinking, being proactive can make all the difference. And let's not forget the importance of consulting healthcare providers. They can offer personalized advice and insights tailored to your unique circumstances. As we wrap this up, consider this. What's most important isn't whether you can drink alcohol or not. It's how well you understand your body and the tools you have to manage your health. Metformin and alcohol can coexist in your life, but they require thoughtfulness and care. Cheers to living well, making informed decisions, and finding the right balance for your health and happiness.